Rubo meaning red. And so we talked about the red nucleus of the midbrain. And I said at the time, the reason I mentioned that was because we would be talking about the rubrospinal pathway. So again, that shows you that it's a descending pathway. All right? So instead of having the cell bodies, the upper motor neurons in the colliculi, these upper motor neuron cell bodies form the red nucleus. So they would be coming from here, again crossing over in the brainstem. And descending, this is involved with unconscious control of posture. So it's going to cross over in the brainstem and then end up in the anterior gray horn for lower motor neurons. Okay? So again, the lower motor neuron pathway would be the same as for cortical spinal, but the upper motor neuron pathway is different. It doesn't start in the cortex, and it doesn't cross over in the pyramids. It crosses over at the brainstem level. Yes?
How many neurons is that?
2. Upper motor neuron is cell body is in the red nucleus. Lower motor neuron cell body is in the anterior gray horn.
What's happening in the pond?
It's just about the cerebellum. You haven't raised the.
Oh, okay.
Oh.
Sorry. Thank you. Didn't mean that to be confusing. That was the synapsing with the previous pathway. So upper motor neuron is in the rubro, the red nucleus. Lower motor neuron, like all the rest that go to the spinal cord, forms the anterior gray horn.
So the second one is the one down there?
Yes, the second neuron, the lower motor neuron,
Anterior gray horn.
is anterior gray horn.
So it's going through the medulla.
Still goes through the pyramids, but doesn't cross there.
It crosses here.
Yeah, crosses in the brainstem on its way over.
So just to be clear, say this happens to be the one that gets chosen, what is it that you want us to label?
All right, so if I had this on, and I said diagram the rubrospinal tract for the extra credit one, I would want you to label this as midbrain, label this as red nucleus, cerebral peduncle, pons, medulla, medullary pyramid, anterior gray horn, ventral root, spinal nerve, ventral ramus, and upper and motor and lower neurons.
Spinal nerve.
Yeah. So just any of the structures that the nerves are passing through, and then the names of the nerves.
And obviously medulla, so that stuff, right? Okay, so that goes to here, and then synapse is here. So ventral,
One pathway left.
not too bad. And then that's the upper.
And again, use the names of those structures. Does it say rupro? I can't change it. It should be rubro,
Oh,
not rupro. It's on a PDF document. It's not a slide, so I can't change it. All right, so we have one left, and this is vestibulospinal. So what was our cranial nerve that had the word vestibulo in it? Vestibulocochlear. All right. Cochlear referred to hearing, and vestibulo refers to balance. All right. So we have the cerebellum involved with balance, getting information from the inferior cerebellar peduncles and middle cerebellar peduncles. But we also have the vestibulospinal coming from where the vestibular nuclei, information comes into the cerebellum, and then the vestibular nuclei are not nuclei of the vestibulocochlear nerve because those would be outside. Those are sensory. So the vestibular nuclei are formed by the upper motor neurons and the posterior pons of the floor of the fourth ventricle. And actually these don't end up crossing over Okay? So it's going to be on the same side and come down and do the same thing. So they start in the floor of the fourth ventricle. Do not cross over, pass through all the same structures, and end up in the gray anterior gray horn.
Oh, do this one.
So this is walking. When I walk, I reflexively maintain the balance. So when I lift one leg up, I'm not going to fall down. Okay? As I'm flexing one leg, it causes the other leg to stay extended, so that I don't just collapse.
What is this thing today?
Oh, it's just the floor of the fourth ventricle. Oh, these are the medial lemniscus for the previous. You don't have to worry about that. All right, so those are the 5 motor pathways. Now, if I showed you this pathway on the exam, and I said identify the neuron, would you be able to identify it as upper or lower motor neuron? So I didn't have anything named, I just had this pathway, and I said identify this neuron. Okay, I don't want any first, second, third order neurons. It doesn't pass through the dorsal root ganglion. It's not a sensory pathway. It's a descending pathway. All right? So I don't want any first, second, third order neurons. So then your choices are upper or lower. Lower is going to be in the anterior gray horn, unless it's a cortical bulbar tract. And then it's always the lowest neuron, since it's named lower motor neuron. Okay? So typically on this exam, in addition to the extra credit, I will have 2 or 3 of these pathways already drawn out for you. I make them really tiny. So I draw them and then I shrink them, put them across the top of the page, and then I might have a 1, a 2, a 3, and so on. And the same questions: identify this tract, identify this neuron, identify this structure. Okay, and so I might have a bunch of different things for you to choose from: red nucleus, cerebral peduncle, nucleus cuneatus, gracilis. And so, as you're studying, be aware that for the pathways, identify the pathway, identify the structure, identify the neuron. Whether you visualize it or whether I ask you to draw it. Okay? And they're the same structures, except for, say, the red nucleus, that we have been studying as external structures on the brain stem or on the brain. Okay? So
no retreat.
yeah. So is this a sensory or a motor pathway? I don't know if you can see it in the back. All right, a couple of things tell you it's sensory. 3 colors, 3 neurons. Rather than having a cell body in the gyrus, we have a nerve ending. Dorsal root ganglia, posterior gray horn. All right, so you can imagine that I will feel very disappointed if you call this a motor pathway when I've given you all those clues. All right, or vice versa. So here's the first 2 motor pathways that we just talked about. Notice where their cell bodies are. Cell body in the gyrus rather than the nerve ending. Okay, cell body in the anterior gray horn. Nothing posterior about this pathway. Cell fibers in the, that actually should be here, not in the red nucleus. Fibers in the pyramids, in the peduncles. Okay, so the clues are there. So I won't, have enough of these diagrams that you can visualize that. You don't have to just pull it cold from your memory. Yes?
Did you say that all motor pathways have to have some sensory?
Yes. Not all motor neurons.
Okay.
But what I'm saying, not a motor pathway. These motor pathways don't have any sensory.
Okay.
Nerves. So a spinal nerve, all of our spinal nerves are mixed, with one exception that we'll talk about when we get to muscle unit. But say ocular abducens, all right? It's a motor pathway. It's lower motor neurons coming from the midbrain, but there will be incoming proprioception fibers. Okay, so included in the ocular motor nerve will be a few sensory fibers that tell you what position your eye is in. So that's the only one I'm talking about. All motor cranial nerves would be a better way of saying it. Will include sensory neurons carrying joint sense or proprioception. So if it's a question that says, which of the following, and so I usually phrase it as characteristically. So the abducens nerve is characteristically motor, sensory, or both? Motor. Okay. What about trigeminal? Both, because the chewing is more than just a small sampling of proprioception. Okay. So yeah, I recognize that, but then that's why I have that word characteristically. It's known for that
Can we
function.
go back to this too?
Sure. All right, so that's the end of lecture.